Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series of where we highlight some of our amazing PA members and how they work in their respective fields and utilize telemedicine. My intention is that this serve as an opportunity for us to connect and network together and also to highlight our amazing members. You know I believe that we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thanks so much for joining us today. Today I have a very well-respected PA who is a medical educator as well as an administrator who has helped set up 8 PA programs in the US and has done some amazing work internationally to help set up the PA profession there in Netherlands. Allow me to introduce you to Dr. Ken Harbert. Hi Ken, how are you?
I am so well. So nice to see you. How are you?
I'm doing well. Thank you so much for joining us today.
Thank you so much for having me. It's just a real honor.
Thank you, Ken. Can you start by stating your name, how long you've been a PA for, the many areas of medicine that you have practiced in, and specifically with telemedicine now, please?
My name is Ken Harbert. I don't use the doctor really because I do have a PhD, but I'm a PA. So bottom line is I've been a PA for a few years, 45 years, and I've done a number of things as a PA. I started out in psychiatry as one of the first PAs in psychiatry. I left psychiatry, became a hospitalist, went into be part of a trauma team for a while, went from there to internal medicine, there to family medicine, from family medicine to occupational medicine, which I really enjoyed. Became an administrator in occupational medicine for a while and started some programs there. And then ended up by doing academic medicine, which I've done for many, many years, about 20 some years, and also administration. So I've been in charge of a large healthcare system group of physician assistants, nurse practitioners, and nurse midwives, which was an interesting role because I had 3 different professions that I was juggling. And I've also been involved as a project director and the lead for a military telemedicine project, and I've been involved in telemedicine since 1994. So it's been a few years that I've been involved in telemedicine. Currently, my role is Chief Operating Officer for an organization and company called Catalyst Healthcare Services. And it's a telemedicine service that is really a coalition of a number of different companies that work, ironically, in the Caribbean. So I get to sit in North Carolina. I'm not in the Caribbean. Sit in North Carolina and do a lot of my work and see a lot of my patients. And more importantly, really work with administrators and others. Recently I've had a connectivity issue. So we've looked at, low flying satellites and kinds of things that administrators do in telemedicine rather than the direct patient care, which I miss a lot. But the bottom line is in order to provide access and delivery, we need a platform. That platform is a 24/7 platform. And if it's not working, I'm kind of the guy they call and say, what do we got to do? How do we make it work? And during bad storms and things like that, or just, as you know, equipment, which is forever going down, all those ones and zeros are going somewhere else. So that's what I'm currently doing.
That's amazing. Thank you, Ken. Can you tell us a little bit about what you find to be a challenge with telemedicine and what you like about it?
Well, it's a yin and yang. It's the old Chinese saying of yin and yang, and the other saying that I've always liked from the Chinese is, may you live in interesting times. We live in very interesting times. 1994, I got involved with a Navy project, Office of Naval Research, and doing a project called SIRMUSA. And this is just my explanation to what you said. And that was a center of excellence looking at remote and rural medically underserved areas. So the idea was the military wanted us to do it in very remote and rural areas so they could expand it to the military. And what I liked about that was that we started in the beginning working across the country and across the world, really, and bringing people together, both providers and patients, so that we could provide access and delivery. But we also did some other interesting things, like we were able to get sat phones and use them for emergency medical care, so the paramedics or EMTs could take actual pictures of motor vehicle accidents or a trauma and then have it teleported to the ER, so the ER would be able to say, well, do this, do that, do this. don't do that, bring the person. And the team would already be ready for somebody when they came in. So that was what I really liked about telemedicine. What I like about it is it's that connectivity, it's that connection of us helping someone else. And we can do it in so many different places in so many different ways, whether it's a mobile unit, whether it's you and me speaking from Texas to North Carolina. What I like to tell people when I go out, and I gave a talk at the University of Mississippi about this, and that is everybody who has a cell phone, all these cell phones that we have today, that's what telemedicine is about. And if you think about it, I was doing telemedicine way back in the Coast Guard when I was a Coast Guard medical officer, because guess what? I'm 3 weeks away from land. I've got somebody with an open fracture of the femur. We're not going to hit land. What do? I'm not an orthopod. I'm not a surgeon. I call up a surgeon, wake him up in San Francisco and say, hey, I got this person that has an open fracture. What do I do? And that was the way of taking care of that patient back then. That was in the early 80s, late 70s, early 80s. So telemedicine really has been telephone consultation forever. So, if people know this, but actually the history of telemedicine for PAs was first done in the pipeline in Alaska, the transatlantic pipeline, because they actually had an ultrasound machine that they could actually use in remote areas up in Purdue Bay or up near the middle of the Antarctic. And certainly the military has been using it. Today we have 16 PAs that work in the White House. They use telemedicine every second of every day, and it's all done by cell phone, or it's done by their wonderful magic that they call screens that they use to connect with their patients. The problem with telemedicine is that for some of us, me particularly, who's a little older, it's interesting that the older physicians, older healthcare providers, again, have trouble with that technology. They're not really sure of how to use it. And the other problem that we have with telemedicine is easy to get, easy to forget that this is really a clinical interaction. So you might be chewing gum. You might have had a bad day and your eyes are tired. You're drinking coffee or eating at the same time you're talking to a patient, or they're doing the same. So there needs to be some kind of way, again, if you look back at the old way that, practitioners have seen patients forever, it's that patient-centeredness. Carl Rogers was the one who came up with that term as a psychologist. And that really means that I'm listening to you. I'm not telling you, I'm listening to you, and active listening to you. And at the same time, the beauty of telemedicine, also the problem with telemedicine, I can read your body language. And I know whether or not you're really getting what I'm saying, or you're really angry or upset with me. So it's a different, and I think this is very interesting for a lot of individuals, it's a different way of dealing with a patient. We're there for our patient to provide care, understanding, education, all those things. And for some of us, it takes a little bit of learning to how to do that through telemedicine. And the other thing is, guess what? Technology is not perfect. We don't have AI right now, and we don't have quantum computers, which someday we will. And AI is getting better and better. And the bottom line is that there are going to be problems. There are going to be hiccups. If you're sick or you're upset or you're angry, you might have a really bad experience with telemedicine, just like you might have a bad experience with a patient. You lose connectivity, a storm comes up or something, the patient's just about to tell you how they're really feeling or a trauma they've had, and you lose it. And to go back to that is really hard, in that in the old days, when we had a patient right in front of us, we could feel that pain, we could feel that agony, we could feel that anxiety, particularly in telepsychiatry, which I've done also. It's not easy sometimes. You really need to be able to read someone. But probably the most important thing is doing what I'm not doing, which is listening.
No, you're doing wonderfully. Ken, thank you so much for sharing all that history, those pearls, those gems. I'm so thankful and grateful that you were able to share that with me, with all of our students who are watching, and all of our fellow PAs also watching in on this. But thank you
Oh,
so much for your time. I so appreciate it. And we look forward to connecting with everyone else soon. Take care, everyone.
great. Thank you. Bye-bye.
Bye.